Hello, in this lesson, we will be discussing diarrhea. We will look at their causes, mechanisms, complications, and treatment options. Diarrhea is very common and mostly results from contaminated food and water sources. Diarrhea is widespread throughout developing countries. But if you think that diarrhea is only prevalent in developing countries, think again. For instance, in the US, there was a notable increase in both the frequency and severity of diarrhea outbreaks in 2024. Similarly, Taiwan reported a significant spike in diarrhea-related emergency and outpatient visits in February 2025. This shows that diarrhea is truly a global health issue. So, what is diarrhea? Diarrhea is commonly defined as passing loose watery stools 3 or more times a day. However, different people may have different definitions of diarrhea depending on their normal bowel habits. What is normal for some may not be normal for others. So if the individual is passing loose stools more often than normal, it can also be considered as diarrhea. There are 3 clinical types of diarrhea: acute watery diarrhea, acute bloody diarrhea, also called dysentery, and chronic or persistent diarrhea if the diarrhea lasts for 14 days or more. Let's look at acute watery diarrhea, which is the most common type. You might hear people refer to it as gastroenteritis or stomach flu. The main culprits are typically viruses, particularly norovirus and rotavirus. Bacterial infections, such as E. coli, are also common causes. While protozoa can cause diarrhea, these infections usually last longer and are more likely to cause chronic rather than acute diarrhea. Food poisoning is also another common cause. It's important to note that even properly cooked food can cause food poisoning if bacterial toxins are present. These toxins can remain active even after the bacteria themselves have been killed by cooking. Acute watery diarrhea starts suddenly and lasts for a short while, usually around 24 to 48 hours. The condition is self-limiting, meaning that patients will get better even without treatment. Infectious diarrhea is always transmitted through the fecal-oral route, which occurs when someone consumes food or water contaminated with feces. This can happen in various ways. Perhaps a food handler doesn't wash their hands after using the bathroom, or water used in food preparation is contaminated with sewage. When someone develops acute watery diarrhea, they'll typically experience several symptoms. The hallmark is watery stools that usually resolve within 72 hours. Patients also commonly experience abdominal cramps and flatulence, that's excessive gas. They may feel nauseous and vomit. General weakness and malaise, that's the feeling of being unwell, are common, and fever may be present. Since acute watery diarrhea resolves by itself, no antiviral or antibiotic treatment is needed. The aim of treatment would be to prevent dehydration and relieve symptoms. Now let's discuss dysentery or acute bloody diarrhea. What makes this condition distinct is the presence of blood and mucus in the stool. Dysentery can be caused by bacteria or protozoa infection. The most common causes are Entamoeba histolytica, which is a protozoa, and Shigella, which is a bacteria. Unlike acute watery diarrhea, patients with dysentery typically experience more severe symptoms. Besides the bloody mucus-containing diarrhea, they also suffer from significant abdominal pain and fever. This condition requires specific treatment targeting the causative organism, which is the bacteria or protozoa. Now let's look at chronic diarrhea. Chronic diarrhea is defined as diarrhea lasting more than 14 days, and it can have numerous causes. Let's go through them systematically. First, we have irritable bowel syndrome or IBS. This is actually the most common cause. IBS patients experience abdominal cramps and altered bowel habits that can swing between diarrhea and constipation. Inflammatory bowel disease, or IBD, is more serious. It causes severe inflammation of the intestines, with Crohn's disease and ulcerative colitis being the main types. Malabsorption syndrome is where the small intestine can't properly absorb nutrients. The nutrients stay in the intestine instead of being absorbed, leading to diarrhea. Chronic infections, particularly those caused by protozoa, can persist and cause ongoing diarrhea. Bowel tumors can also disrupt normal bowel function, leading to changes in bowel habits. Some surgical procedures involving the GI tract can also result in chronic diarrhea. Certain medications may have diarrhea as a side effect. Lastly, we sometimes see cases of self-induced diarrhea from laxative abuse. Sometimes a person who wants to slim down may abuse OTC laxatives because they believe that the laxatives will prevent food from getting absorbed. But in fact, by the time the food reaches the large intestine, most of the calories have already been absorbed by the small intestine. They are just losing mainly water and electrolytes from their system, which can be dangerous. Although there are numerous causes of diarrhea, there are several basic mechanisms which cause most of them. Let's look at 3 common mechanisms. Number 1, increased osmotic load. This is when unabsorbable food or solutes stay in the bowels and retain water. Normally, the small intestine and colon absorb 99% of the fluid from oral intake and GI tract secretions. But when there is a high concentration of solutes in the intestines, water is retained in the intestines instead of being absorbed. This results in diarrhea. Some examples of such solutes include PEG and lactulose, which are used as laxatives. Another common example is lactose intolerance, where the person does not produce sufficient lactase enzyme. As a result, lactose, which is usually consumed in milk, cannot be hydrolyzed and absorbed. The lactose remains in the intestinal lumen and causes osmotic diarrhea. Number 2, increased secretions. This is when the bowels secrete more electrolytes and water than they absorb. Causes of increased secretions include infections and certain medications. Number 3, decreased contact time or surface area. This is when there is insufficient time or surface area for the intestines to absorb water effectively. Decreased contact time can be caused by increased intestinal motility, which can be caused by drugs or hormones which stimulate the intestinal smooth muscle. Reduced surface area could be caused by surgery, where a part of the gut has been removed or bypassed. Diarrhea causes the person to lose water and electrolytes. Fluid loss can lead to dehydration. Some signs of dehydration to look out for would be dry mouth and thirst, decreased urination, dark-colored urine, or even unusual behavior such as tiredness, dizziness, or confusion. Severe diarrhea can result in vascular collapse, which is a significant drop in blood pressure, leading to decreased blood flow to the vital organs in the body. This serious complication may occur particularly in young children, elderly, and those who are ill. Electrolyte loss can also lead to low levels of electrolytes such as sodium, potassium, magnesium, and chloride. Now that we understand how diarrhea works and its complications, let's look at the different types of medications we can use to treat it. We'll cover 6 main categories: fluids and electrolytes, adsorbents, antimotility agents, bulk forming agents, antibiotics, and probiotics. Fluid replacement is the cornerstone of diarrhea treatment. While drinking water helps to replace fluid losses, it's not enough on its own. Here's why. Your body needs both water and electrolytes such as sodium and potassium to function properly. Oral rehydration salts, or ORS, are specially formulated to provide the right balance of water and essential electrolytes. They come as powder in sachets that need to be mixed with water. Another alternative could be isotonic drinks, which also provide water and electrolytes. ORS is generally very safe. A possible side effect is overhydration, which can be observed as puffy eyelids, particularly if given too quickly or in excessive amounts. Adsorbents work by binding to fluids, helping the stool to be less watery. They may also bind to toxins that might be causing the diarrhea. Common examples include activated charcoal and kaolin. Adsorbents can bind to other medications too, not just toxins and fluid. This means we need to tell patients to take their other medications at least 2 hours apart from the adsorbent. Otherwise, the adsorbent might bind to their other medications, making them ineffective. Anti-motility agents are powerful tools in managing diarrhea, but they need to be used carefully. These medications work by slowing down the contractions of intestinal muscle. The stool travels more slowly through the digestive tract, and this allows more fluid to be absorbed by the intestines. Examples of such medications are opioid-based medications like loperamide, brand name Imodium, and diphenoxylate with atropine, brand name Lomotil. In Lomotil, diphenoxylate is the opioid, and atropine is an inhibitor of the muscarinic acetylcholine receptors. Atropine is added to discourage abuse. The atropine causes unpleasant side effects if someone takes too much. In terms of side effects, loperamide is generally safer because it doesn't cross the blood-brain barrier, so it causes fewer opioid-related side effects. Diphenoxylate and atropine, on the other hand, can cause drowsiness and anticholinergic effects from the atropine, like dry mouth, blurred vision, urinary retention, and confusion. An important precaution: these medications should not be used in dysentery, which is caused by bacteria or protozoa. Why? Because they can trap harmful bacteria in the intestines and make the infection worse instead of better. We often think of using soluble fiber to treat constipation, but in fact, it can also be used in diarrhea to help firm up liquid stools. Common examples include psyllium with a brand of Metamucil and ispangular husk in the brand Fibrogel. These agents can cause some abdominal bloating and pain initially. Also, be aware that they can affect the absorption of other medications, so proper timing of doses is important. Since bulk forming agents can help with both diarrhea and constipation, they can be especially useful in irritable bowel syndrome or IBS, where patients experience alternating periods of diarrhea and constipation. Antibiotics have a specific role in treating diarrhea. We only use them when we are dealing with bacterial or protozoal infections. Here there is an important bacterium, stated here, Clostridioides difficile. What is C. difficile? It is a bacteria which can cause severe inflammation of the colon and, ironically, is usually associated with antibiotic use. When someone takes antibiotics, these drugs can kill off the normal healthy bacteria in their gut. This creates an opportunity for C. difficile bacteria to multiply and produce toxins that can cause severe diarrhea. This infection is more common in hospitalized patients, and it can be very, very serious. Antibiotics such as ciprofloxacin or azithromycin can be used for traveler's diarrhea, while metronidazole or vancomycin are used for C. difficile infections. Remember, most cases of acute diarrhea are viral and self-limiting, so antibiotics are not usually needed. Using antibiotics unnecessarily can lead to resistance and might even make things worse by disrupting the normal gut flora. Probiotics may also have a role in managing diarrhea. These are live microorganisms such as bacteria or yeast that can help to maintain beneficial gut bacteria and inhibit the growth of pathogenic microorganisms. They can be especially useful when taken after a course of antibiotics to prevent or treat antibiotic-associated diarrhea. Here are some examples of probiotic strains which have been shown to be useful for diarrhea. When someone has diarrhea, One other symptom that often occurs together with it is abdominal cramps. Abdominal cramps are caused by intestinal spasms, which are involuntary contractions of the smooth muscles of the intestines. Abdominal cramps usually occur in conditions such as gastroenteritis, irritable bowel syndrome, which is IBS, as well as food allergy. Abdominal cramps are treated with antispasmodics, and one commonly used medication is hyoscine butylbromide, also known as Buscopan. That's the brand name. Buscopan is an anticholinergic drug. It works by blocking the action of the neurotransmitter acetylcholine or ACH. So normally, acetylcholine binds to muscarinic receptors on the gastrointestinal smooth muscle and causes contraction. So by blocking these muscarinic receptors, Buscopan prevents smooth muscle contraction, and this allows the intestines to relax. An important advantage of Buscopan is that it has poor systemic absorption and does not easily cross the blood-brain barrier. This means that its effects are mainly limited to the gastrointestinal tract, so that makes it relatively safe with fewer central nervous system side effects compared to other anticholinergic drugs. Now let's remember the anticholinergic side effects using a common mnemonic: can't see, can't pee, can't spit, can't shit. So can't see refers to blurred vision or visual disturbances. Can't pee refers to urinary retention. Can't spit refers to dry mouth due to reduced production of saliva. And can't shit refers to constipation from reduced gut motility. With Buscopan specifically, patients may experience some blurred vision or visual disturbances. Hence, patients should be advised not to drive or operate machinery if this happens. Another common side effect is dry mouth, which is due to reduced saliva production due to the anticholinergic effect. Mebeverine, also known by the brand name Duspatalin, is another antispasmodic used to relieve abdominal cramps caused by intestinal smooth muscle spasm, especially in conditions such as irritable bowel syndrome. Unlike Buscopan, mebeverine is not an anticholinergic agent. Instead, it works as a direct intestinal smooth muscle relaxant. The exact mechanism of action is not fully understood, but it is believed to involve multiple mechanisms. Mebeverine should be taken half to 1 hour before food because abdominal cramps that are associated with IBS are often triggered or worsened after meals. So taking it before food allows the drug to relax the intestinal muscles before the food triggers the spasms. Since mebeverine acts directly on the smooth muscle of the intestines and does not block neurotransmitters, mebeverine does not produce typical anticholinergic side effects. As a result, mebeverine has a low frequency of side effects and is generally very well tolerated. Let's summarize the main points about diarrhea that we have covered in this lesson. First, we recognize the 3 clinical types: acute watery diarrhea, acute bloody diarrhea or dysentery, and chronic diarrhea which lasts more than 14 days. Remember the 3 key mechanisms that cause diarrhea, which is increased osmotic load, increased secretions, and decreased contact time or surface area of the intestines. Diarrhea can also cause complications, and the main ones are dehydration and electrolyte imbalances. In severe cases, this can cause vascular collapse. For treatment options, remember that there are fluids and electrolytes, which is the mainstay of treatment. Then other treatments are chosen based on symptoms and cause. So there are adsorbents like charcoal, which bind toxins. There are anti-motility agents like loperamide, which are effective but they cannot be used in infectious diarrhea. Bulk forming agents can help to increase the bulk of the stools. Antibiotics, these are only for specific bacterial or protozoal infections. And probiotics, which help to maintain or restore the normal gut flora. Lastly, we also covered a short segment on abdominal cramps which often occur with diarrhea. Abdominal cramps can be treated with antispasmodics, including hyoscine butabromide and mebeverine.